Hello, everyone. It's great to see physical therapists from all over the country. I'm PT Lord, here to guide you from mindset to development. For this session, I brought 3 research studies. Hearing the word research might make you feel a bit intimidated, right? But there's no need to think of it as difficult. Let's just go through each one together, step by step. So, what are the topics of these 3 studies? When a patient comes in and says, for example, "Oh, I went hiking the other day and now my muscles hurt." Or maybe they say, "I twisted my ankle." When someone comes in like this, what do you usually do for them? Most of you probably apply ice. I also used to apply ice most of the time in clinical practice. So, this topic is about ice packs, hot packs, or heat therapy. I've brought studies that look at whether we should use heat therapy or cold therapy during the acute phase when a patient comes in. Usually, we say to do RICE during the acute phase, right? Rest, then apply ice, use compression, and elevate. We often talk about these 4 components. And those interested in sports medicine probably know that RICE has now evolved into PRICE. And recently, something called POLICE has come out as an update to PRICE. If you look at the progression from RICE to POLICE, you'll see that while we have interventions for the acute phase, there are no interventions for the subacute to chronic phases. So, while we talk about the acute phase, the treatment plans for the subacute and chronic phases are still lacking, which is why this study proposes to suggest a method for those phases. If you look at this study, it covers anti-inflammatory drugs in detail. For example, let's say you get injured or sprain your ankle. In situations like that, we usually take anti-inflammatory medication, and it does help to relieve the pain. However, there are studies showing that, in the long term, anti-inflammatory drugs can actually hinder tissue regeneration. So, today I'm going to talk about peace and love, which are approaches you can use to manage injuries and immediate post-injury care. Peace is for managing the acute phase, and love is for management after the acute phase, so you can think of it as the peace and love approach. First, if we summarize the 5 components of peace, P stands for protection. This is a giant. A is for anti-inflammatory, meaning we want to avoid things that trigger an inflammatory response. C stands for compression. And the last E is for education. Let's take a closer look at each of these. It's the first blood. P stands for protect, meaning you should protect the injured area. Make sure to protect the injured part as much as possible. Until when? For about 1 to 3 days, you should focus on protection. Don't overexert yourself. It's not that you shouldn't move at all, but if the pain is severe, move a little bit at a time to reduce the pain. So, this doesn't mean you shouldn't move at all. Using a spray bottle or something similar can also be one way to help. Just think of this as part of the protection process. Next up is E. This is elevation. Elevation means you should always keep the injured area above the level of your heart to help reduce swelling. Doing this can help reduce bleeding and swelling. That's the recommendation. And then, and this is a particularly important key point to remember, means that you really shouldn't take any anti-inflammatory drugs or apply ice at all. So, this part might be met with a lot of resistance. Why are they saying not to use ice packs? I always use ice packs. A lot of people might say that. When I was in clinical practice, I also used ice for patients who came in during the acute phase. Even now, at sports sites, everyone applies ice after exercise and before recovery training. So why are they suddenly saying not to use ice? That's what people might think. So the key point here is that using ice definitely has the effect of reducing pain. Anti-inflammatory drugs also help reduce pain. But if you think about what inflammation is, what is the inflammatory response? It's the body's healing process. In other words, it's the process that heals your body. You need to let this healing process run smoothly for the tissue to recover. Based on this, some say that suppressing inflammation is not effective for tissue regeneration in the long run. So, let's allow a certain amount of inflammation and let the body go through its natural recovery process. This is the main point behind the idea of not using anti-inflammatory drugs or suppressing the inflammatory response. Of course, this can be controversial. So when I looked at the data, most of the current studies are conducted on mice or other animals rather than on humans. That's why this controversy can arise. Later on, when large-scale studies are conducted on humans, I think it will be necessary to take another look at the use of ice. For now, since there is some controversy, if you feel like this approach makes sense, not using ice could be one option to consider. Now, the C stands for compression. Compression means applying pressure. How do you apply compression? Usually, you wrap something like tape around the area to provide compression. You use a bandage or tape to apply pressure. Doing this can help reduce swelling and bleeding, which is why compression is recommended. Now, the last one is education. Education refers to patient education. As we've moved toward the BPS model and similar approaches, there's been a lot of emphasis on education. Especially in other countries, it's not easy to see physical therapists or doctors directly, so the frequency of direct visits is lower, which is probably why there's even more emphasis on education. Education is about providing patients with accurate information. You can present information about what your prognosis will be like. And manual therapy, where you receive passive treatment, is good. It does help reduce pain and things like that, but in the long run, pain relief is only effective if the patient takes an active and proactive approach themselves. That's why this kind of education is necessary. Usually, when we're in pain, we just lie down no matter what. We take a rest. But you should get adequate rest and then try to move around a bit. It's important to give this kind of advice as well. As for how much you should move, if the total VAS, visual analog scale, score is 10, it's now considered okay to have pain at about a 2 or 3 out of 10 while moving. That's why it's better to move a little rather than not move at all. This way, your circulation improves and it can help stimulate the healing process. This is what we're saying these days. By giving patients guidance on the overall direction of their treatment and what they should do, I think therapists can also gain more trust from their patients. So, I believe that this kind of education is absolutely necessary during the acute phase. Alright, up to this point, we've covered the essential management steps right after an injury during the acute phase. Now, moving past the acute phase, we're going to talk about what kind of management should be done starting from the subacute phase. We're presenting this using the acronym LOVE, and the L stands for load, meaning you should start applying some load. Let's think positive thoughts, let's be optimistic, that's what we're talking about. For V, it means to ensure good blood flow and circulation, basically, make sure the blood is circulating well. And finally, the E stands for exercise, make sure to do exercises. So, these are the 4 things being suggested. Now, let's take a closer look at each one. The first one is L. It's a road. It means you should apply some load. You might be wondering, what does that mean? In the acute phase, we told you to just rest. Take a rest. We talked about protecting and safeguarding, so why are we now saying to apply load? Now, since we're at the subacute stage, after some rest, it's time to start applying load. There is a need to make the organization stronger through subordinates. It can also help prevent things like atrophy. So, if the pain isn't too severe, let's say on the VAS scale it's around a 2 or 3, then, since the pain isn't that bad, we recommend that you keep moving. Especially after the subacute phase, we advise you to keep moving and to put some load on your body. Now, the second thing we're going to look at is O. O stands for optimism, or having a positive mindset. So, why do we need a positive attitude and optimism? If we just got injured, what does that have to do with anything? You might think that way, and that's a perfectly reasonable thought to have, especially in a clinical setting, but optimism is actually extremely important. Why is it important? If you look at the theory of pain in the past, it is called the gateway control theory. It's referred to as the gate control theory. A person named Melzack developed it. But after that, Melzack introduced a new theory. He brought in what's called the pain matrix theory. Pain doesn't act in just one place, it's related to several areas in the brain. He explained that there's a strong correlation between pain and emotions. That's why emotions play an important role in pain. In the psychosocial model, psychological factors play a key role in pain. That's why I don't think I'll get better. If you think you won't get better, your recovery is bound to be slower. But if you think, oh, I think I'll get better quickly, I think I'll improve, and you have a positive mindset, then your prognosis is much more likely to improve. If you have strong trust in your therapist or doctor, the placebo effect can help you recover even faster. So, always remember that when you have a positive mindset about movement or pain, your recovery and performance are likely to be better. That's why I think it's also part of a therapist's job to instill a positive attitude in their patients. Now, the third point is vascularization. Vascularization means promoting good blood circulation. Aerobic exercise is recommended. For example, let's say you injured your ankle. I hurt my ankle and it hurts so much. Then it's advised to use aerobic exercises for other parts of your body to help improve circulation to the injured area. So, by improving blood circulation, you can speed up the healing process. Don't just stay still, keep moving and continue doing aerobic exercises, or if you're pain-free, even light anaerobic exercises at about a perceived exertion of 2 or 3. That's the advice being given. Lastly, let's take a look at exercise. Isn't exercise the same as load? That's what you might think. Strictly speaking, load just means adding some stress during your daily activities. Exercise, on the other hand, refers to more systematic rehabilitation or rehab exercises, or workouts aimed at improving performance. It also means you should do exercises to prevent injuries and avoid getting hurt again. So, when you do exercise properly, your risk of re-injury can go down. That's why it's important to do exercises that strengthen weak areas or improve your performance. And as you all know very well, exercise plays the final role when it comes to pain. If you used manual therapy at first to reduce pain, I think everyone knows that exercise must be included for pain prevention and recovery. So, starting from the management of adverse events, we've looked at a total of 4 things about nerves. If we review once again, the first is to apply load. Then comes positive reinforcement, and V stands for blood vessels and blood flow, things like that. Do aerobic exercise. And finally, exercise. We've looked at these 4 things. To sum up at the end, it goes like this. Alright, let's wrap things up. When it comes to managing soft tissue injuries, what's important is to look at it from a long-term perspective rather than just a short-term one. Secondly, we need to remember that we're treating the patient, not just the injured area. While it's important to focus on the specific area, it's also necessary to take a holistic approach and consider the patient's psychological state and other factors. That's why things like education and fostering positivity are included here. So, as therapists, we need to be able to educate our patients and help instill a positive mindset in them. Now, the third important point about peace and love is that it's not about short-term management. The goal is long-term management and prognosis. That's why peace and love can be even more meaningful. Finally, if you have any soft tissue problems, I suggest you try using a peace and nub first. So, when a client or patient visits your physical therapy clinic or center and you think it's an acute injury, I recommend that you try applying peace and love instead of rice, price, or police. I hope this will be helpful in your clinical practice. Subscribing and liking really helps us create more content. Thank you.